First, to thank all the presenters and for great presentations. Very interesting mid-afternoon. I think if the chair approves that we could follow the same strategy as we did in the earlier session and just ask committee members who would like to pose questions to go ahead and use their great. Veronica, let's start with you.
Thank you very much for a very, very interesting set of presentations. I really enjoyed the overview of the different agencies and the nuances you gave to some of the issues. First, a question to Kelly. I was struck by the example that you gave from Nigeria and the video that you showed about the small company or small medium company. One thing that I would love you to comment on is a little bit the tension between the safety of the consumer and at the same time the cost that goes with it, and at the same time perhaps the lack of the demand for that safety. So what I'm assuming is that this kind of middle-sized company might be willing actually to invest in more safety standards, producing a product which then costs a little more because they have to invest in that safety. The demand on the consumer side for that might not be there. So that's one thing I would love to comment on. Then one question for Lisa. I was struck that you mentioned the constant struggle in your office in health systems, which is a horizontal, not a vertical office. It's a horizontal one, not disease specific. It's a constant struggle to get funding for these horizontal issues, which is certainly regulatory issues at cross-sectional to so many things. What is the business case the donors can make? Because we have talked a little bit more from the committee side, what can be done, but from the donor side, I was wondering what could be that business case that donors can make. And one last question to all of you is, there are certainly knowledge gaps, and all of you seem to have touched on some of them. So knowledge gaps, I mean by that, in terms of best practice, or how should we go about this issue? What could be done in X case or in Y case? How could you, as donors, pursue some of the knowledge gaps? Not as donor agencies. You said we are not technical agencies, but elevating these and saying if we know what would best practice be, we could be much more efficient in investing in certain practices. Thank you.
Thank you. I'll start by answering the initial questions. Thank you very much. So really good questions. We're starting to think about this, and one of the things that I found really compelling, a finding that I didn't actually share from the Global Food Safety Partnership Food Safety in Africa report, is that in their consultations with private sector, they were hearing loud and clear that companies, they want to hear from consumers, but consumers aren't organized in a lot of places in which that we're focusing. So so let's go back to Nigeria. I don't know the specifics of Real Fruit's case. I could find out, and so I'm kind of compelled to do that. But right now, it's not clear it's not clear that there's a consumer demand for safety. There, you also mentioned the point about cost. So it's interesting. There is a tension within the Bureau for Food Security as our markets teams work more closely with our nutrition team. The assumption that we're going to cost food out of the scope of possibility for poor people. That's one that we're confronting. But there's some new research occurring. Partners like IFPRI, the Institute of Food Policy Research Institute, and ILRI, the Institute of Livestock, and thank you. They're doing willingness to pay assessments. There was a recent report that I'm aware of just a few weeks ago, it was published, coming out of Ghana and fisheries, and we're showing that consumers are willing to pay for safety. So we're going to be paying very close attention to the work coming out in this area. I think this is also related to your question around knowledge gaps and what can we do about it. We certainly are positioning ourselves to invest in generating more of that kind of information, because we need to challenge those assumptions, and they're going to look differently depending on the kind of product we're talking about. The Bill and Melinda Gates Foundation has supported some really interesting work called ARENA, partnering with IFPRI and a consortia of universities. And they recently took stock of, I think, 5 years of work, and they're just beginning to really build the evidence to help distill what are the, how do consumers interact with different kinds of goods and different qualities of goods. We're talking fisheries, we're talking livestock, dairy, and fruits and vegetables. So we're looking forward to that. And I think I wanted to note one more thing, that that USAID is positioning ourselves to invest in what we're calling a food safety innovation lab. In a few weeks, we'll be able to share more information about that. But that is part of our commitment to working with U.S. land-grant universities and their consortia. And this lab is designed to really help us focus on some of the knowledge gaps at all levels, including the household level, so that we can better understand what factors affect behavior.
Okay. Thank you, Veronica, for the great question. I think if I solved it here today, that would be really wonderful. But it's actually something that, I don't know, comes up all the time. So just the other day I was talking with someone and I said, I wonder, we always think it'd be so great to have health system money, but I wonder if it would be that great, right? I think there's a certain value in the challenge of combining disease-specific funds and necessarily looking for commonalities and intersecting mandates and needs. So I don't know. That's just my kind of philosophical thing that I get to think about a lot. But I think that where we are in terms of the business case is looking for those aligned interests. So I support a couple of projects that are health systems projects. One of them works on product quality system strengthening specifically, and the other on pharmaceutical system strengthening more broadly, including regulatory systems, and all of our funding comes through these different disease streams. And the places that we can do generally the most interesting work are, countries where we have multi-disease funding and can sort of weave together a fabric of a program that meets the specific needs, but also strengthens the country's system. So I do think that that approaching it as a business case is a good sort of terminology or framework to think about there, and looking for those areas of commonality, recognizing the constraints, but then also saying, okay, within those constraints, let's talk about what an approach. If you could buy me 3 more months or 6 more months to take a slightly more sustainable or completely, more sustainable approach, that may actually be a better business case looking at the return on investment of the funding that's being allocated today, into the future. And I think that gets particularly, I think that gets stronger as we get closer to this sort of self-reliant state in certain countries, where the countries themselves are starting to demand cross-cutting horizontal assistance. And so, as we sort of think about what this journey to self-reliance looks like for our individual disease programs, sort of identifying the points along that process where we can or we can make the business case for system strengthening investment, not just because it's the right thing to do, but also because it furthers moving these disease programs that have, presidential congressional mandates, but that it fulfills those mandates while also strengthening the country system in the long term. I guess the hope also is that, as countries, well, my personal hope, I guess, is that, as we're thinking about supporting countries, for example, that have made commitments towards UHC under SDGs, and that there is sort of a new focus from countries of their own bottom line, and that, for example, if they've made commitments to purchase quality assured products for a certain disease category that's also of interest to the U.S. government, but they haven't been able to figure out how to finance that because they're spending money on, let's say a small amount of high-priced oncology medicine or something like that. Maybe that's a controversial example, but that we're able to sit down and help them rationalize their overall spending on medicines to achieve their own objectives and sort of our needs as well. So sort of some creative thinking there. And one thing that I didn't mention earlier is also just the sort of risk that goes along with some of the kind of push to expand coverage and again, looking at commonalities. So we've had conversations with a couple of our disease control programs, one of which is, for example, maternal and child health and malaria are both concerned, and probably the others are both concerned with the quality considerations that go into countries' own procurement decisions. So that's an example of where we can sort of help make the business case there. Two very different programs, but with a common interest.
So maybe the question was not directed to me, but as a donor, we receive also a lot of requests to support national regulatory system. And based on my past experience, I am the one that provide advice from time to time. My institution is very demanding and asks for clear impact, outcome, whatever you can say. And this is to some extent what I always refer. Strengthening regulatory system, strengthening is a never-ending story. Every regulators in the world need to be strengthened. For me, it is not the point. The point is where you want to reach and where you are coming from. And the main lack that I feel, is the lack of, I would say, situation analysis. If you want to reach a level, let's say, to be able to register generic medicine, okay, it's very easy. You set the bar, you know what you have to know, you know what the guidelines you have to implement, and you train. But if you say you strengthen, you never know when you have to stop. So if you don't know where you are sure not to be able to reach the point that you want, in particular if you don't know the point that you want to reach. And this is what we are trying to do for the pharmacovigilance system that we will support, is what are the indicators that will provide an idea of the situation. 2, if the value change, then we can demonstrate impact. And it is not rocket science. It is always somewhere. You have indicator on the system, on the process, on the outcome, and you apply this. We have a set of indicators already set in place for pharmacovigilance, number of adverse drug reactions per million of inhabitants. We have 8 in Zambia, 11 in DRC, 9 in Kenya, and something like this, based on our data. If we provide technical assistance, we should be able to see that these data have moved from this part to this part. And it is the same for the process, how many signals are generated by the regulators based on the adverse drug reaction they have received. I like the point that you have to begin. Yes, you have to begin somewhere. It's not perfect, but we have maybe 7 indicators for now. And maybe in 1 year we will have 10 or 20. But I think it is important to pave the way and to know where we are and where we want to go clearly. There is a lot of literature that show what are the level of intervention that we have to apply in a regulatory system is not the first system that are supported. Huh? There is different levels. You support the people, you support the process, you support the institution, and you support maybe the institutional arrangement that I would call the system. But all this, take one and implement it. That's all.
Thanks. Do you have comments about, there was a general question about knowledge gaps and things needed to be known for best practices, or anything else you want to comment on?
Just a little bit. I wanted to also comment on this struggle from the health systems, because I was mentioning it is quite interesting for us, again, particularly in immunization, where the regulatory aspects are quite important. When we look at the health system investments, that they are bottom-up, they're coming from countries. There's only one country that requested or allocated resources to strengthen the NRA, Djibouti. All the rest did not. When we look at our technical assistance, also is bottom-up, now country-specific bottom assistance, it's only 2% out of the total technical assistance that we provide is related, and it's only related to monitoring adverse events following immunization. Nothing again on this strengthening. So a purely bottom-up approach is not really working. I don't know, is it not working because it's very program-specific? Yeah, and in this case, immunization managers, they don't feel, they're not close, they don't feel they have the expertise, they don't request. We don't know where is that gap, but there is a gap. And this is where we are thinking now, do we need to be a little bit more prescriptive? Do we have to, what I mentioned before, have this concept of readiness in terms of for transitions? Because if we want sustainable programs, they need these sustainable institutions, and therefore identify what is that minimum criteria, so to be a little bit more prescriptive on how some of those resources need to be allocated, because if not, it's not happening.
Well, thank you very much. Excellent presentations. First, Santiago, I wanted to ask you about the vaccines market. What do you think about this permanent unlimited demand versus limited stock of vaccines in the world? How do you deal with that problem on a year-to-year basis? Do you negotiate prices with the companies? Do you help countries to negotiate prices with the companies? And what happens, for instance, what I've heard is that for the following year, we will not have a BPH vaccine. So there's no stock of the vaccine. And sometimes companies say, well, there's no commercial interest anymore, so we will not manufacture vaccines of this or that. So that's a problem. And my question is, how do you deal with that? In Mexico, we have a negotiation table with the manufacturers in order to expand our levels of demand and lower prices. No? And that has been substantially decreasing the prices, and our capacity to buy has been widened in the years. So what's your general opinion about this market, which is not comparable with the medicines market, no? And for Lisa, just a couple of questions. What are the amounts of resources that you are investing in the countries first, and then what's the criteria to select a country? Income or population, epidemiology? What are your main criteria to select countries? Thank you very much.
I will try to answer as much as I can. So Gavi works in terms of our market shaping strategy. We work with our partners. So mainly it's UNICEF Supply Division that we use as a procurement agent for most of the countries. And we work with PAHO Revolving Fund for the Americas. And the idea behind is that, of course, increasing demand, and with increased demand, then use some financial tools that we have because of our resources to secure guaranteed demands that perhaps our UN agencies cannot do. We help with that in order with that objective of reducing pricing. Now, as you said, the vaccine market is a little bit different because it's not about we don't have generics. It's about technology, access to technology, particularly around the new vaccines, the HPV, the pneumococcal vaccine. So the question is, and just increasing demand alone does not decrease prices. It's how do you bring to the market these new manufacturers? And this is where we are now seeing attention because there has been a lot of attention about or efforts on reducing pricing, but we are seeing now some of the manufacturers coming out of the market because they don't see it as profitable. So the question is, how do we manage that market in a way that we reduce prices to make it more appropriate, but at the same time, we need to be aware of that. We need to be aware and create the incentives for new manufacturers to come, particularly from developing countries, where that will bring prices down. And this is what we have seen, for example, in the pentavalent market. We hope to see very quickly in the rotavirus. But what we are seeing right now is a little bit of this in some of these markets, particularly the HPV, some concerns in terms of supply. We have seen even in some vaccines that in the past, because of the outbreak type of disease, yellow fever, also we have seen some challenges. So hopefully through our securing some funding, providing that visibility, that predictability, will create enough incentives for other manufacturers to come, and that will help to increase the supply base. Also, we work very close with other partners, particularly the Gates Foundation, which they do a little bit more investments in terms of technology transfer and a little bit working on so we can have the pull and push side of the elements and not just one side.
So easy questions to answer. In terms of the resources, I'll have to give a little bit of an story, I guess. So at least the Global Health Bureau, we are fairly decentralized in the way that resource decisions are made. In the sense that the main mechanisms that we have, the projects that we have that support regulatory system strengthening, the two I support are what we call central programs. So they're these large global programs that are available for our USAID mission colleagues in country to buy into, to invest in, to receive specific services. And then we also have sort of Washington-based teams that also can access these mechanisms. And certainly we could get you more data on this if that was of interest. But just to give a flavor, so for example, the Promoting the Quality of Medicines program, which is a program that supports specifically the product quality subset of the regulatory system, if you will, receives about $15 million a year, at least in the most kind of recent iteration. That's both from investments coming from our missions as well as our Washington colleagues. The program that's more comprehensive, that deals with many aspects of the pharmaceutical system, including regulatory system, was a 6-year project. It just ended recently, 6-year project that was total $226 million. But again, that's not the data on just the regulatory piece. And the main message there is that relative to the other types of investments that we make, for example, around the availability of medicines, the investments in regulatory system strengthening is really small and could be quite a bit more. Obviously also a biased perspective as sort of an advocate for this area. but it's not a huge amount right now. Although, as I mentioned earlier, we have a new program now, which is a follow on to the SciOps program called Medicines, Technologies, and Pharmaceutical Services, MTAPS. And there we've actually seen, we're only 6 months in, so we get to sort of wait and see who wants to kind of our colleagues buy into which services. But we've already seen several missions that are making primary investments in regulatory system strengthening. So that's encouraging. And in terms of the country's criteria, basically each of the disease areas has their priority countries that they've determined, and we can share those. And so those are sort of our priority focus countries as a bureau. But again, these mechanisms are available to any USAID mission that would like to buy into them. So, each of the disease programs have different criteria for how they set up their own priority countries. But since this is sort of a horizontal area, we work with other priority countries. And I think it's about 52 total, the main priority countries for Global Health Bureau.
Jono?
Yeah, thank you. Great panel. Three questions. One is that one of the core questions that we have is around regulatory authorities and their sustainability, financially and all, their keeping up scientifically, they're avoiding regulatory capture. And so one observation is that we have often drug regulatory authorities that start up. Many countries have drug regulatory authorities, no food authorities. They're beginning to have food authorities. We've got the FDA where it's together. And Mikel has made the point that in Mexico, Julio Frank, the minister, when they set up his entity, specifically put as many things in the regulatory function together as possible, in good part to protect against the regulatory capture, so they each have different communities. So the question is whether as agencies grow, restructure, whether there's a view and whether the Commission should take a view on the benefits of actually doing it in a collective way. Where you've got at least food and medicine and maybe others, and whether that will help both achieve their objectives. The other is a question on food, on the food nutrition, and the safety nutrition connection with food. With medicines, we first decided in the 1930s we should have quality, and then about 25 years later we said we should check on safety, and then a decade later we should check on effectiveness. And I'm wondering, we talk about food safety, and are we at a point now where we really need to link food safety and nutrition? I mean, clearly from a public health point of view, nutrition is a huge issue. But I'm not sure what the thinking is of making that just the way we say quality, safety, efficacy in medicines. Does it become the mantra and the routine that it's safety and nutritiousness, or safety and nutrition for food? And the third one, for Elaine, I felt much better after you intervened there. I was getting worried that you thought pharmacovigilance was hopeless. But I do have a question. You noted that there was like a tenfold or more difference in the neural tube defects. I thought you were going to describe a study to figure that one out. But is there any follow up on that in deciding whether there actually is a concern? Because we do tend to take a long time to pick out safety issues.
Elaine, do you want to just respond to that one directly, and then we can go to the general question? Do you want? Yeah.
I don't have any news for now. I think we are waiting for the outcome of the investigation and the also the study to go on and to provide more data. I think there is tenfold, yes, but we are waiting. So I don't want to be so alarmistic. It is just a case study, just to show and to make a demonstration.
So returning to Jono's first question, and for everybody on the panel, what do you see is the best scope of regulatory institutions? Is it functional to have food and medicine together or separate, or in what circumstances?
I would answer as a non-regulatory expert. But I think definitely we need to start working more together. And I think this is something that we, at least particularly from a donor perspective, I think this is changing significantly the environment. If we look at purely just from a health perspective, the years where health ODA was increasing to records amounts is the past. There is now more difficulty in terms of development assistance to maintain, not to increase. So there is greater competition. We have now many other new environment, also very important things. So I think we need to work in new ways, and we need to work in better ways. And it's very interesting now that we are in the same building with the Global Fund. We're finding almost daily opportunities to work together in terms of how can we do business in a different way. We're talking to the same regulatory agents. We're talking to the same procurement agents at country level. So how can we, that's from the medicine and the vaccines, but some of our agencies, they are two different departments, so we talk only to the vaccine department, others talk only to the medicines department. But how can we really merge? And I think definitely we need to look at from other sectors. I think cross-sectorial engagement, it is going to help us in what is going to help us to turn and to achieve the SDGs. I think as long as we continue with a narrow view, I think it will be extremely difficult and not efficient.
I'll also, as a non-regulator, respond to that. I certainly won't make a recommendation, but I will say that, kind of reflecting on some of your comments, as we think about, and this is getting to your question as well, as we think about within the Bureau for Food Security, and actually USAID will be standing up a Center for Nutrition. We are talking daily about the importance of health systems and food systems. We can't strengthen food systems to deliver on nutrition if we don't, at the same time, see advances in health systems. And so the imperative for us is to work more closely together and to send consistent messages to our partners when we're working with governments and others. So, just some food for thought. We're there. We're at that space where we're going to need to really work more closely together. If I could, unless somebody else wants to take the regulator or the regulatory agency question, I'll also respond to the other question around nutrition and food safety. So I think I understand the question you're asking. I guess, are we there? Are we really saying that? Or, but so, a few things, like who is our audience? I think from USAID's perspective, I mentioned that one of our audiences is our own staff, our own colleagues. So this $1 billion, for example, there's a lot of power in influencing resource allocations. And so we're talking about people like Lisa and me and others. And so who decides, right? But I think that one of where we feel we might have some traction in having everybody see themselves in delivering on nutrition, which is so essential, is to make that link between food safety and nutrition. So, for example, our agriculture officers, our economic growth officers, and our nutrition and health officers. How can everybody see themselves and in their resource allocation roles in delivering on nutrition? And we see food safety as that natural link. Because food safety touches markets and all the different actors whose behavior we want to change. We all have a role in influencing different parts of those systems. So so from that perspective, yes, we really, that's where we're going. But then the conference that I mentioned and some of you attended in Addis Ababa, the FAO, WHO, and African Union co-sponsored this conference, and the focus was public health. food safety and public health. And the Global Food Safety Partnership is certainly, having some influence on how we think about that. There's a secondary conference that's happening in Geneva where the focus will be more on trade, and that's happening in just a couple of weeks. But I think we're there. I think we're there. I'd love to hear others' thoughts on that, though.
Yes. Regarding the scope of work, that's remind me the discussion that we had internally in my agency, where we say, we have to be organized by products because we are very specialized. Oh no, we have to be organized by process because we will gain efficiency. And I think there is no ideal model. And this may depend on first, your maturity. Second, your strategy. You should not. I think my knowledge from all these regulators is that you should not embrace too many products at the same time. So begin with one type of products, build your experience, knowledge, your process, and then you can expand. If you bring everything, if you want to embrace too many products, then you can plan to hold no products.
Yeah, and I want to second the importance of the question. So I don't necessarily have a recommendation, but I do think there's value in looking at fragmentation wherever it exists, whether it's within the drug regulatory system, but then asking the question, does it make sense or not to combine these? I think is really important. I am thinking that. One of the aspects that we've asked our mechanisms to look into is also these cross-sectoral links, and as health people, for example, we don't often interact with customs departments and whatnot, but it may be the same folks in the customs department between the Drug Regulatory Authority and those working on, food safety and regulation, right? And so I think it's a really important question. So I just wanted to second that.
Lisa.
Okay, thank you so much, and I too really appreciated this session. I have two questions. One is for Dr. Conejo. And you mentioned in your presentation the use of these peer-to-peer support systems, country to country. And in the example, you mentioned Thailand and Bhutan. And I was just wondering to what extent you're using that, if there are other examples, and whether you've been able to look at the efficacy of that in any way. I'm just curious about it because I actually found that was quite interesting. And then as Kelly mentioned, the Global Food Safety Partnership did do this study that looked at investments in food safety in Africa over the last 10 years. And the report, as she rightly stated, had very stark results about how these investments and where these investments have gone. And largely they've gone really into trade and not into necessarily food safety for local consumption. The thing is, particularly from where we sit, and I'm curious about this, is that food safety, when we think about it, even as we're talking here, we're trying to make the link between food safety and nutrition. And there is also this question about food safety and food security. And sometimes we hear of development agencies that say we work on food security, but we don't work on food safety. And so the question I have is, as a committee, how do we, and what recommendations do you have for how we place food safety as an important element in development? And for that, what recommendations how can we sort of couch, and what guidance would you give to us as we couch recommendations around support to regulatory agencies that focus on food safety, particularly in the context of whether we consider this as important, for the achievement of the SDGs, a key development issue, an issue that should resonate around trade or around, so I'm just curious about what the development community is is thinking about as it relates to food safety. Perhaps, Kelly, I don't know if you know how other donors are beginning to address this issue or think of this issue, so that we can reflect on some of that in our report.
I think the first question was around peer-to-peer.
Yes. So this is a new approach that we are rolling on in the last years, particularly around what I was mentioning, where we have seen in terms of development of institutions a little bit of a gap. To be honest, this on the one on Bhutan and Thailand that was mainly led by WHO. Was WHO promoted, and I think one of by the team that works on regulatory agencies, and one of the key elements that had institutional commitment from both countries, from the highest level in terms of the commitment from the Thai to support the Bhutanese and vice versa. So that had that reciprocal institutional commitment. And based on that, we have now applied in 2 other countries where we are not just for the regulatory, for other aspects of strengthening delivery of immunization services. We have now done Sri Lanka and Timor-Leste. Also, we have looked at how to strengthen primary health care delivery, given the very successful practices that are in Sri Lanka. And in Angola, also another transitioning country where they have significant gaps. We have now paired, and here we're piloting a different approach, not just between governments, in this case is Angola and Brazil, given the language, but also with a university. So to bring not just the practical, but also the academic side too. So we are doing a tripartite peer-to-peer, so to strengthen the public health institute in Angola, we are linking it with the university in Brazil, and at the same time the government to help win on the day-to-day practice and problem solving. These are all novel. We are going to start evaluating them next year to see if they have really what has been the impact, but it's some of the new ways that we are trying to see. What I can really say is that demand is incredible from countries. What we are seeing, what we are being requested more and more is they want to know and see and talk to other countries that they are facing the same issues and how specifically they resolve. So in fact, we have created a network of these countries in transition to themselves identify the challenge, and they try to share experiences on how they have been resolving some of those challenges on transition.
Thanks, Listra. So I'm trying to think about how best to answer this question. I think I'll focus on some of the opportunities that I see. I do think that the Sustainable Development Goals are unifying principles. We see donors aligning with those, and we know that food safety features prominently in several of them. But we also see companies developing their own Sustainable Development Goal strategies for delivering on Sustainable Development Goals. So I think it's important to also reflect as we think about donors, but think about broadly, who's investing in this space, and companies are part of that community. I also think that as a bilateral, so I do have some familiarity with how a number of development donors are thinking about this. I think that that we're talking more about it than ever before. I do think that that certain key global meetings are helping to drive this agenda, and I'm frankly I'm looking forward to seeing what might be on the agenda for the G7 coming up. And I think that those kinds of platforms are really important for driving agendas. I do think that leadership is really critical. As a bilateral donor, we have priorities. We want to be involved in evidence generating and priority setting, but fundamentally we take our leads from our country partners, our government partners. So what's really exciting when I think about the recent announcement by the African Union to create an African Food Safety Agency, who knows if it's going to actually happen, but it is a vision, and the African Union is serious about putting a proposal on the table for an October 20 2019 meeting to persuade member states to prioritize food safety. So those kinds of, these kinds of movements where you have strong leadership and champions, I think that we can't understate the value of that to drive food safety on the development agenda and food security agenda. And one more point I wanted to make too. Well, actually two. So food security, right? So that's, that's a space where where there's been a lot of attention, and food safety is now on that agenda in the form of a new food safety index that the Comprehensive African Agriculture Development Program initiated, and with support from partners, and for the first time in their biennial review process, which compares member states to one another according to certain indicators, we're going to see where they stand in relation to food safety. But that's coming, and so that is going to also shift the conversation and elevate food safety. And my final point on this question is that organizations like the grocery food, or within the Consumer Goods Forum, the Global Food Safety Initiative, that is an industry association, a food and beverage industry association that has over 1,000 food and beverage company members. They are looking at Africa, and they're not yet there. And they have a model where they build capacity and community of industry to support one another and achieve certain steps of standards, but they're not in Africa yet. So, for example, I'm hopeful that we can create the incentives and the enabling environment that will help them take that risk and get onto the continent, so that they can start to invest in unique ways as well.
Yeah, thank you, Dr. Canejo, and thank you, Kelly. I also just wanted to just one quick statement, just to say that as you talked about USAID being interested in evidence generation, I just want to say that as the GFSP, we are certainly very aware of that, and really want to just thank USAID for taking the leadership in even helping generate the report that we just did, and for several other things that are happening now. So I appreciate your perspectives, both of you. Thank you.
Kathy?
Thank you. My question is also for Kelly. Earlier today, one of the committee members mentioned that we did a workshop within the last month in Costa Rica and met with current and past regulatory officials from quite a number of Central and South American countries. And one of the things that came up through those discussions, kind of a thread that ran through it, was that on the food regulatory programs, moving to a risk-based approach was something that the countries found very desirable, was something that they wanted to do. But we heard from Barb Kowalczyk this morning about the project that she's working on, funded by the Gates Foundation, that is addressing two foods and risk assessments associated with them, a 4-year timetable, and $3.4 million. So moving to a more risk-based approach towards food regulation is something that requires a lot of capacity building in countries, a lot of some fairly basic data development. And my question is, within the Feed the Future initiative, how much of that kind of work would fall within the scope of Feed the Future? And are there currently in any of the projects that are ongoing these types of projects to help build capacity within the regulatory food safety regulatory aspects of countries' food safety systems ongoing? So that's the second part of the question. And then the third is, what are the kinds of alliances that you see that USAID could help to catalyze in developing this capacity for risk-based food safety regulatory agencies in low and middle income countries?
Thank you. I think I missed the first part of it. So I'm going to be responding to the capacity building question and the alliance building part. And I heard you talk about the Costa Rica
Just
meeting.
talk about, you talked about how food safety is on the Feed the Future agenda, on USAID's agenda. This particular aspect of it, building capacity for risk-based food safety systems, is that within the scope?
Yeah. So I'll be brief because I know there are more questions and there's a great panel. But the short answer is yes, it is in scope, and capacity building has been a part of the way we has been a part of our approach for a long time, and the development approach in general. So yes, it's in scope. Platforms like the one I mentioned, the Food Safety Network, which is our way of organizing among USDA, FDA, and USAID, is a great resource for our missions who can direct government requests, for example, to receive technical assistance. One of the things that we're trying to do, and it's really hard, is to move away from meeting what could be considered an ad hoc capacity building, short-term capacity building request, and see how it fits into a larger program vision. That's what we're trying to move towards, so that we move away from short-term capacity building and really see and measure how it affects systemic change. So we're really not quite there yet, but this is all definitely in scope. But regarding the risk piece, we are committed to doing things differently and really helping to focus governments on this when they're asking, but we're not quite sure how we're going to do that yet. This gets to the third part of your question, the alliances. One of the things that we're really proud of is our focus on partnership, and that doesn't necessarily mean that there's a funding transaction, but we're building alliances as part of the way we're doing business, and that includes with our interagency. It includes with other donors, with organizations, industry groups, host country governments, universities. We want to build those where we can. Specific examples of alliances, I think that so going back to the opportunity that I see on the continent of Africa, I am going to be I'm going to be reflecting on the needs that are conveyed by the African Union leadership, and putting a lot of thought into how we can help them organize alliances on the continent, potentially through the regional economic communities, which I think have a lot of potential for driving change. We already work through alliances, for example, with the Global Food Safety Partnership, but I think we should give this more thought, because this is the way we must operate, and we must continue to build out our cross-sectoral approach. And in fact, we have a multi-sectoral nutrition strategy within the U.S. government, and we need to do a lot more to realize the multi-sectoral nature of that as well. And that does touch upon a lot of what we're talking about here. I don't know if that answered your question directly, but there's a lot more to say.
Thank you. We have maybe 15 more minutes, but maybe I don't need all that time for you to respond. So it certainly has been quite enlightening. And I'm very appreciative that now big organizations and funders like you already are starting to integrate strengthening regulatory systems. But I think one of the questions that we wanted to see is, if you really leap into the future, right, knowing that each of you represent organizations that the funding for your organization and the funding that you give out come from very highly developed countries, right? US, UK, Australia, How do you see, can you explain to us, how can you sustain that yourselves, like that your pool of funders, right? That are the typical players. How are you inviting new funders to coming and play, the donor role, especially like the innovative developing countries, right? Like BRICS. How much role, how can they then
add on to the work that you're doing? And do you see that this need of having a donor aid, and how do you eventually see that we can kind of get away of donor aid support, especially in the context of regulatory, right? So this balance of, we always, of course, want to have great donors, but at the same time, we also want to see that there's resilience or the ability of countries to be able to self-fund for these kinds of activities, including food, drugs, as well as regulatory in the systems.
Well,
so I think we'll all get a chance to answer this very good question. If I can just start us off, I completely agree with our other panelists mentioning that financing is not sufficient in and of itself, but it's also the systems that are in place. And so I think, if we're looking at sort of the role that we as donors are playing today and setting up for the future, we can make investments in the systems that will allow countries and others to contribute or to set up sustainable financing models, but based on the foundation of systems and structures that can optimally use that funding. So that's just sort of one big picture reflection, and specifically as USAID in the area of drug regulatory system strengthening. As I mentioned earlier, we are definitely see ourselves in lockstep with the other donors who are coordinating together, for example, through the Coalition of Interested Partners, as CIP, as WHO is calling it, basically a donor group looking at how we're collectively providing technical assistance to support regulatory system strengthening at the country level, using this global benchmarking tool, which is very rigorous and has metrics and can indicate sort of progress along the trajectory. And so I'm not a sort of a part of the WHO management team behind that, but I imagine that is a fora that other interested donors and countries that wanted to also similarly support countries could look at the efforts that are being done country by country and the institutional development plans that are coming out of that process, and how we all can work together to support countries and where they need to go. Certainly, as I alluded to earlier, we presently and even in a best case scenario, there would never be sufficient funding from the U.S. government alone to support regulatory system strengthening. So I think there's many opportunities for others to contribute. And, finally, just another mention for the value of the harmonization, work sharing, reliance efforts, within regions, but then also learnings from across regions, is something that we see value in and we try to facilitate through the work that we're doing. But sort of these alliances and learning opportunities is another, I guess, non-monetary way, but in technical sharing opportunity.
I would try to see how I can answer. One, I think the interesting about the Gavi model and why our focus on sustainability and transition is because actually that is one of the key drivers for donors to invest in Gavi. And when I visited, I think 95% of our transition countries, and it's their success what allow us for us to fundraise. And I think that is very, very important. And I think I was mentioning before, I think in terms of ODA, when we look at the trends of ODA, we're seeing an evolution on that. More priorities, competing priorities, and is not increasing. And when we look at today's world in terms of where some of the movements that we're seeing, in particular those traditional donors, and the uncertainty that there is, so we need to look at new ways. And what we're hearing is, in terms of ODA, focus on the fragile, on the lower income, the most needed. And new donors are not, I wouldn't say that they're coming up or stepping up at the same rate that perhaps others are decreasing or not increasing. And it's more complex. They have different incentives, different views, different cultural ways to look at. So I think we need to really see, because we are used to working or fundraising with our traditional donors. And I think now we need to look at how do we see in that environment. But I would say that at the end of the day, ODA, when we look at least from the health sector, health financing overall, is a very small contribution. The solution is not ODA. The solution is not to increase ODA. When we look at where most of the funding comes for health systems, is domestic resources, public, private. So the question is, how do we help countries to build institutions, to build the human capacity, to the system, to have more efficient use of their own resources? Because that's where we're going to find some of the additional resources, not from the ODA. I don't think that is the solution. Yes, for some countries, yes, for those with most of fiscal constraint. But I think if we look at globally, I think we really need to see how can we help countries have more efficient use of their own resources, which is the great majority of the resources that have been spent on the health sector.
Yeah, I'd like to completely agree with that. And in my presentation, I mentioned that one of the things we're reflecting on is, for example, an increase of $734 million per year in public investment. That's something that's part of our approach too. We're trying to facilitate that, and we've seen that aligned with a broader food security agenda. But now there's an opportunity to really focus some of that on food safety with more data, the greater ability to measure, to assess the cost of increases in foodborne illness and other kinds of disease. Ministries are paying attention. The Safe Food Imperative report that Steve Jaffe reported on. Those kinds of things will also stimulate investment. So we definitely want to see more of that. But in the short term, I will say that that I mentioned, we're operating within the Global Food Security Act. It was passed. It was reauthorized. It's maintained its authorized budget, which we're really happy about. But we've only been able to do that because we have a strong monitoring and evaluation system, and we're going to need to really keep that strong so that we can make the case for sustained funding in the short term.
Should I say something?
Absolutely.
My experience, I have spent part of my 8 years in WHO to train people, hundreds of people, to register medicine, to inspect facilities. However, my conclusion after all these years is that everything's come from the top. I think it is the leadership that will give, I would say, the solution, because the example came from the top. I have trained a lot of people that they decide to quit the agency because they don't have the pharmacopée, they don't have the tool, they don't have the boss that recognize their job or their knowledge, and they don't want to have someone that is under that have more knowledge. They have not the institution that reward them because they have better competency, and they find other partners that will hire their competency at the right price. And the institution or the environment might not be fully adequate to exert in impartial and independent way. So all these aspects tend for me to think about the leadership first, and also the patient. I think what in all the assessment that I've done in all these developing countries, I always visited patient association or consumer association. One day, I don't want to give the name of the country, but I meet the people and say, you know what? Yesterday I was in prison. I say, you were in prison. Yes, I was in prison because I complained about the institution that I say, okay. So the power will come also for I would say the patient and the consumer awareness. And also there are, for me, also a great elements that can improve the changes. So the other thing that I think my perspective is that also the country should be more, say, honest. I have received a lot of requests to strengthen the quality control lab in maybe most of Africa. Not all the regulators can become US FDA. They have to accept to say that I will not be able to manage this regulatory function. I have to rely on somebody. I have to give up with this. The real mature regulators know that they are not capable to do something and they rely on someone else. Even the mature one. Even US FDA have joint inspection with other regulators because they identify that they don't have the capacity. Acknowledge that you will never have the capacity. You will rely on someone else. You will rely on a regional entity that will give, I would say, some experience, but you will give up some power and some responsibility. But you have to be honest and recognize it. Thanks.
Well, I think that was a perfect ending question. I think we'll sort of wrap up. This question was really around how do you expect the substance and manner of donor involvement to change over the next 10 years? I think that's what you were referring to from several different directions about what we might expect going forward. So on behalf of the committee, I'd like to thank you all very much.